Hi, John, and thank you for joining me today. As you know, we're here to speak about your recent diagnosis of having prostate cancer. So, quickly, our session will talk about education around the diagnosis. We'll talk about possible treatment options and interventions, and then finally, we'll wrap up with what next stage and planning should and could look like, or could and should look like. So the first things first is from a mental health aspect. I don't want you to beat yourself up about the diagnoses. Often I have patients who have a why me approach and sort of what could I have done differently in order to prevent these diagnoses. And the truth of the matter is that prostate cancer is common amongst African American males, and it's frequent. It becomes more frequent the older that we get, meaning that while you may feel it's unique to you, there is a community of support out there for people who have been diagnosed with prostate cancer and are from your demographic. Um, the second thing around the education piece is that prostate cancer isn't sort of a diagnosis that we have to be condemned to death, right? There are treatment options, and we'll begin to go into those now. So, as far as treatment options, the first slew of options is surgery. There are minimally invasive surgeries, meaning smaller incision, quicker recovery time, and essentially that is just a surgeon going in, making an incision, and removing your prostate from your bladder and your urethra, and then connecting your bladder and your urethra together, and then monitoring your signs for any remaining cancer after that. So you may say, hey, what are my signs of the cancer, right? It's your PSA, your prostate specific antigen produced. It could be found through a simple blood test, but it's usually one of the first indicators that we have of prostate cancer and its development. The second sort of batch of options, in which there are many underneath this particular batch, is radiation therapy. And there are a few different types of radiation therapy. There's external radiation therapy, meaning through a big machine of sorts, we will point direct the radiation towards your prostate, and it's a longer set of treatment. So with your surgery, it's maybe 4 hours tops of the surgery, and then 2 to 3 days of recovery time. With your radiation therapy, it's sessions over a longer period of time. We're talking weeks. So you may see the side effects from radiation are a little bit more prolonged simply because the treatment is prolonged. So we spoke about the external beam radiation, also known as EBRT. Usually one of the more effective when methods when combined with the surgery for physical removal of your prostate. There's also radiation seed therapy, in which we insert small seeds into your prostate, and that gives a very high dose of radiation in a very concentrated area. Now, this too is a fairly effective method of treatment, but a little less invasive because, again, we're inserting a little bit more intrusive as we're inserting radiation seeds inside of your prostate, and they have to remain there. There are also hormone therapies and other therapies, cryotherapy, that are not as well researched and produced, but have found to be effective in certain cases for those diagnosed with prostate cancer. So, what I like to, as we begin to think about the types of therapies from a mental health aspect, I'd also like for us to begin to consider what does support look like as you're going through, whether you choose radiation therapy or surgery. It's important to have a support system, people who will be there for you. But think of it as more of your friends who will be there to speak to you before and after either the surgery or the radiation therapy, and as you go along in your treatment process. People who you can call and depend on and just reflect and bounce ideas and thoughts of. Or maybe even someone you can alert if you're not feeling so well, or maybe if you feel you have side effects for the day and you'd like them to accompany you to the hospital or get you to the next level of care. Um, and finally, I'd like to wrap up with the continued mental health aspect. It's important for you to, as you're developing your support system and you're going through what can be a difficult time in your life, to continue to seek support, whether you believe in a higher power or not, or whether it's through your friends and your family or an informal network, maybe even through coworkers at your place of employment. Build that network and lean on them in this time, and you'll find that it can give you energy and just have resources at a time when you may not feel that they're needed, but they can come in handy. As we used to like to say in the military, we hope for the best, but we also prepare for the worst. And with that being said, we will meet again in about another 2 weeks to begin to talk about what support systems you have put in place and your treatment option that you decided to go with. I'm going to send you with a few pamphlets today about each of the options, and you decide what's best for you as far as recovery time and as far as effectiveness and sort of how you feel it fits into your day-to-day life schedule. Because again, just because we're diagnosed at this stage doesn't mean that we have to become the diagnosis or let the diagnosis dictate sort of our lives and how we choose to go about it. Okay? All right, John. Thank you for meeting with me today, and we'll be in touch soon. Here's my card. Just in case you have any questions, please always feel free to call.